For the fifth straight day, India has set a new global daily record of new coronavirus infections, with more than 352,000 reported on Monday. The rapid surge has overwhelmed the country's healthcare system as hospitals scramble to expand critical care units and secure reserves of oxygen from the nation's dwindling supplies. New Delhi officials have extended a lockdown in the worst-hit city by a week, while international aid trickles in to help alleviate the crisis. Laila Humairah reports.
Employees at this gas plant in the Indian city of Ahmedabad have been working non-stop for days. They're rushing to refill hundreds of oxygen cylinders. Then it's a race against time to deliver them to hospitals around the country. A nationwide oxygen shortage has crippled many hospitals. They've been forced to turn away new COVID-19 patients, leaving them waiting in line outside.
We brought the oxygen on our own. The treatment has started, but we don't know what time our number will come to get inside the hospital. There's a huge line of patients waiting.
Please do something and please release some oxygen supply. People need it here. People need beds here. People need meds here. People need wards here. People need injections. People need medicines.
The number of new cases and deaths hit new highs on Monday as India's healthcare system teeters on the brink of collapse. The new wave is believed to have been spurred by a so-called double mutant variant of the coronavirus, which is more transmissible. The US is leading an international effort to help alleviate the crisis.
There's discussions about really ramping up what we can do on the ground: oxygen supplies, drugs, tests, PPE, as well as taking a look in the intermediate and long run about how we can get vaccines to these individuals, both immediately now, as well as in the situation where you help them to be able to essentially make vaccines themselves.
France and Germany have joined the cause, pledging to send medical aid, while the UK has already shipped 600 pieces of equipment to India, including ventilators. Indian Prime Minister Narendra Modi has faced criticism over his reluctance to impose a second nationwide lockdown, favoring continued economic activity. Modi has also come under fire for holding political rallies in recent weeks and allowing big religious gatherings to take place. To help control the spread, New Delhi officials have extended a lockdown in the city by a week. Analysts say the shutdown of the capital is likely to derail a steady rebound in the economy. They're also warning of a knock to full-year GDP if the crisis isn't under control by the end of May. Laila Humairah, TRT World.
Well, let's get more on this now with our correspondent Ishan Russell, who's in New Delhi for us. Good to have you back with us, Ishan. Now, we are seeing those devastating scenes play out across India, people dying, waiting for a hospital bed, waiting for oxygen, hospitals being overwhelmed across the country. Can you just describe to us what is the situation like where you are in the capital right now?
Well, the situation remains rather worrisome and grim. Just a statistic for you, there's one person dying every 4 minutes in India with COVID-19, and that's the situation that was as of yesterday. The numbers keep mounting on a daily basis. Over 350,000 infections were reported in the past 24 hours, and cumulatively India for the past 3 days, for example, has added over 1 million cases. Now, even if a fraction of those cases require hospitalization, it is still a huge number. Even a 1 to 2% of 350,000 on a daily basis trying to get into hospitals has proved overwhelming for India's and New Delhi's hospital infrastructure, and therefore you have advertisements being put out by Delhi's Chief Minister, the administrative head of Delhi, in newspapers asking for oxygen, asking for anybody to come up with solutions, be it corporates or other governments, to help out with oxygen. And that is the big crisis that is unfolding right now, that you might even have beds available for people to come in, but you have to give them high concentrated oxygen, and that certainly is not happening, and therefore you have a situation where people are literally dying in the corridors of hospitals, in ambulances outside hospitals, because A, there simply aren't enough beds, and even if beds are available, then oxygen is not available to sort of revive a person, because that's the first line of treatment. As far as the other things go that are required is, of course, medicines, more medical personnel, but just the sheer number of the daily caseload that keeps adding up on a daily basis is proving to be a huge challenge, that no matter how much or how quickly you try to ramp up infrastructure, it just is not being able to catch up.
Now, countries like the US and UK, as well as companies like Google and Microsoft, whose CEOs were born in India, they've all pledged to help India in the fight against this second wave of the pandemic. Can you tell us what's being promised?
Yeah, certainly so. For example, Sundar Pichai from Google has promised $18 million in relief towards oxygen, towards other medical facilities and supplies that can be ramped up. Similarly, Microsoft and Satya Nadella have also committed towards this fight against the pandemic. And similarly, across the world now, countries are waking up to the challenge and the catastrophe that is unfolding in India. So you have the US, after much criticism and delayed action, that you had the US president last night, India time, reach out and say that we will do what we can to ensure that help is provided to India. That helped us when we required emergency drugs like remdesivir, which India had, and hydroxychloroquine, which India had sort of transported to the US despite an export ban. So that reciprocity is there. Sorry about that. But the other countries are also stepping in, like the UK, providing ventilators. Singapore sent in cryogenic cylinders for oxygen. So the global efforts are on, certainly, and are underway, but the challenge does remain on the ground, that even if you get all these supplies, to get them to the right place at the right time, the supply chain for that logistic is proving to be a huge challenge, and that 1 year of preparation that India had between the first wave and the second phase and has not happened is proving to be a spanner in the works.
And we know Prime Minister Narendra Modi is coming under a lot of fire for his handling of this second wave, so much so that the government is actually asking Twitter to remove some of those criticisms. Can you tell us what's being said about his response?
Well, as far as the government's reaction is concerned, yes, the government has been, and for a while now, has been rather sensitive about what is said about it, rather than the handling of the crisis. And that is why a lot of people, especially out on social media, because Twitter has really emerged as one of the platforms where people are seeking help and are getting that help. Because initially, when this sort of these huge numbers started coming in, government helplines and other resources that were there were simply not functional or could not provide the adequate response. So you had citizens really helping out each other, with ranging from hospital beds to oxygen supplies, to oxygen cylinders, medicines. All these things are being done at a very citizen initiative-led movement, and that has led to a situation where you have a lot of blame being put on the government, because at the end of the day, the government or the leaders of the present dispensation were certainly part of election campaigns and rallies that were being carried out even as this pandemic was raging across in its second wave. And they've come in for a lot of criticism for that, and that criticism perhaps might be reflected in the ballot that the remaining the states that were going to the polls might show. But beyond that, the criticism, yes, is there. The government on its part is saying that adequate steps are being taken now. But as I said, that gap between what is coming in and what is required right now is proving to be a huge gap.
Okay, Ishan Russell in New Delhi, do stay safe, and thank you again for joining us.